As we age, the vitamins and minerals we consume play a significant role in maintaining energy, muscle strength, immune function, and mental clarity. While we're often reminded about the importance of a balanced diet, not all vitamins are equally beneficial for seniors. In fact, some vitamins, when consumed in excess, can actually harm your health, especially if they interact with medications or disrupt nutrient balance in the body. In this video from NUTRIHUBBLISS, we'll dive into the 4 vitamins that seniors should never touch. Vitamins that can cause toxicity, digestive issues, or worsen existing health problems. We'll also discuss the 4 vitamins you absolutely must eat for strong bones, boosted immunity, mental clarity, and muscle recovery, all critical factors in healthy aging. Many seniors are familiar with the idea of supplementing with vitamins, but the truth is, not all of them are necessary, and excessive supplementation of certain vitamins can cause harm over time. On the flip side, some essential vitamins are often underconsumed in older adults due to dietary restrictions or aging metabolism, leaving many nutrient gaps that can hinder well-being. By knowing which vitamins to limit or avoid and which ones to incorporate more of, you can make informed choices that support muscle strength, bone health, cognitive function, and immune health. So, let's begin by exploring the first vitamin that seniors should steer clear of, especially if they're dealing with chronic conditions or are on medication. The worst vitamin number 1, vitamin A. Too much can harm bones and cause toxicity in seniors. Vitamin A is essential for eye health, immune function, and skin maintenance, all crucial for aging bodies. However, while it's important to get enough vitamin A, too much can have serious consequences, especially for seniors. In fact, excessive vitamin A is one of the worst vitamins for seniors to consume in large amounts, and it can cause toxicity that leads to a range of health issues, including bone fragility, liver damage, and muscle weakness. Vitamin A comes in 2 forms: preformed vitamin A, retinol, found in animal products like liver, eggs, and dairy, and provitamin A, beta-carotene, found in plant-based foods like carrots and spinach. While beta-carotene is converted into vitamin A by the body as needed, retinol can build up in the body, leading to hypervitaminosis A, a condition that occurs when vitamin A accumulates in toxic amounts. For seniors, this is a significant concern because aging bodies are less able to process and excrete excess vitamin A, especially if they are also taking supplements or eating a lot of vitamin A-rich foods. High levels of vitamin A can cause a variety of symptoms, including nausea, dizziness, headaches, and even bone thinning, which can increase the risk of fractures. This is particularly dangerous for older adults who are already at risk for osteoporosis or joint issues. Let's take the example of Lily Cooper, a 76-year-old retired baker from Chicago, Illinois. Lily had been taking vitamin A supplements for years, thinking it would help improve her skin and vision. However, after a routine checkup, she was found to have high levels of vitamin A in her blood. Her doctor explained that her bone density was decreasing, likely due to the excessive intake of vitamin A. Lily was advised to reduce her supplement intake, and after several months, her bone health improved, and she noticed fewer aches and pains in her joints. For seniors, the safe upper limit of vitamin A intake is about 3,000 micrograms, acid grams per day. But most people get enough through their diet without needing additional supplementation. Vitamin A toxicity typically occurs from overconsumption of supplements rather than food sources. Foods rich in beta-carotene, like carrots, sweet potatoes, and spinach, are much safer, as the body only converts as much beta-carotene into vitamin A as it needs. In summary, while vitamin A is critical for health, too much can harm your bones, liver, and overall well-being, especially for seniors. Excessive vitamin A from supplements or animal products can lead to serious health issues like toxicity and bone loss. Seniors should focus on getting vitamin A from safe food sources like colorful vegetables and limit supplement intake to avoid potential risks. Next, let's move on to the second vitamin that many seniors are taking in excess, unaware of the potential risks. The worst vitamin 2, vitamin E, an antioxidant that can be dangerous in excess for seniors. Vitamin E is often hailed for its antioxidant properties, helping to protect cells from oxidative damage and supporting skin health, immune function, and heart health. However, despite its numerous benefits, too much vitamin E can have serious consequences, especially for seniors. While vitamin E is essential for overall health, excessive intake, particularly from supplements, is one of the worst vitamins for seniors to overconsume. One of the primary risks of too much vitamin E is its impact on blood clotting. Vitamin E acts as a blood thinner and, when taken in high amounts, can increase the risk of bleeding. For seniors, especially those who are already on blood-thinning medications like warfarin or aspirin, this becomes a significant concern. The combination of vitamin E and blood thinners can increase the likelihood of dangerous internal bleeding or bruising, which can have severe health consequences. In addition to interfering with blood clotting, excessive vitamin E can also cause digestive issues, including nausea, diarrhea, and stomach cramps. Over time, high levels of vitamin E may interfere with other fat-soluble vitamins, such as vitamin A and vitamin K, leading to deficiencies that affect bone health and muscle function. Let's consider the story of Josephine "Josie" Clark, an 80-year-old retired school teacher from Albuquerque, New Mexico. Josie had been taking a high-dose vitamin E supplement for years, believing it would help prevent heart disease and improve her skin. However, she began noticing that she was bruising easily and experiencing unexplained bleeding. After a visit to her doctor, Josie was advised to stop taking the vitamin E supplement, as it was likely interacting with her blood pressure medication and increasing her risk of bleeding. After discontinuing the supplement, Josie noticed fewer bruises and felt more stable in her overall health. The recommended daily intake of vitamin E for seniors is about 15 milligrams or 22.4 IU. However, supplements often provide much higher doses, leading to toxic buildup in the body. Most people can get enough vitamin E from food sources such as nuts, seeds, spinach, and broccoli, without the need for additional supplementation. In summary, while vitamin E is a powerful antioxidant, too much can lead to dangerous health risks for seniors, especially blood thinning, bleeding problems, and digestive issues. Seniors should focus on getting vitamin E from natural food sources rather than supplements, unless specifically recommended by their healthcare provider. Next, let's explore the third vitamin that seniors should be cautious of, particularly when it comes to supplementation and its potential effects on health. The worst vitamin number 3, vitamin D. Too much can lead to toxicity and harmful effects on bones. Vitamin D is essential for bone health, immune function, and muscle strength, especially in seniors. It helps the body absorb calcium, which is critical for maintaining strong bones and preventing conditions like osteoporosis. However, like all nutrients, too much vitamin D can have negative effects, making it one of the worst vitamins for seniors when consumed in excess. While vitamin D deficiency is a significant concern for many older adults due to reduced sunlight exposure and dietary restrictions, over-supplementing with vitamin D can lead to toxicity, which can result in high calcium levels, kidney damage, and bone pain. When the body accumulates too much vitamin D, it causes hypercalcemia, a condition where there is too much calcium in the blood, which can weaken the bones, impair kidney function, and even affect the heart. Let's consider the case of Arthur "Art" Sutherland, an 82-year-old retired mechanic from Denver, Colorado. Art had been taking vitamin D supplements for years, believing that they would help improve his bone health and prevent fractures. However, after a routine blood test, His doctor discovered that his vitamin D levels were much higher than normal, and his calcium levels were elevated as well. Art had been taking too much vitamin D, and it was starting to affect his kidneys and bones. After reducing his vitamin D intake, Art felt better within a few months, with improved energy and less joint pain. For seniors, the upper safe limit for vitamin D intake is about 4,000 IU per day, and it's important not to exceed this amount unless under medical supervision. The body can usually regulate vitamin D levels naturally through sunlight exposure and diet, so excessive supplementation should only be considered under the guidance of a healthcare provider. While vitamin D is vital for overall health, oversupplementation can be dangerous, leading to toxic buildup and serious health complications. Seniors should focus on getting vitamin D through safe sources such as sunlight, fortified foods, and moderate supplementation if necessary. In summary, vitamin D toxicity is a serious concern for seniors who take excessive amounts of supplements. While vitamin D is crucial for bone health, seniors should avoid taking high doses unless directed by their doctor. Getting vitamin D through natural sources and appropriate supplements ensures that seniors can enjoy optimal health without the risks associated with excessive intake. Next, we'll discuss the fourth vitamin that seniors need to be cautious about, particularly as it can interact with medications and lead to unwanted health effects. The worst vitamin 4, vitamin K. Too much can interfere with blood thinners and harm your health. Vitamin K plays a crucial role in blood clotting, bone health, and the maintenance of healthy arteries, making it an essential nutrient for seniors. However, like vitamin A, vitamin E, and vitamin D, too much vitamin K can cause problems. Specifically, for seniors who are on blood-thinning medications, excessive vitamin K can interfere with the effectiveness of these medications, putting them at risk for blood clots and other serious complications. Vitamin K exists in two primary forms: K1, phylloquinone, found primarily in leafy greens like spinach and kale, and K2, menaquinone, which is found in fermented foods like natto, cheese, and egg yolks. While vitamin K is beneficial for bone health by helping in the regulation of calcium, too much vitamin K can be problematic, particularly for seniors who are already on blood thinners, such as warfarin. These medications work by inhibiting the activity of vitamin K, which is necessary for blood clotting. When vitamin K intake is too high, it can reverse the effects of the medication, leading to an increased risk of clotting, strokes, or even heart attacks. Let's take the example of Helen Nellie Rhodes, a 79-year-old retired librarian from Jacksonville, Florida. Nellie had been prescribed warfarin to help manage her blood clotting disorder. She had also been eating leafy green salads daily, thinking they were healthy, not realizing that her intake of vitamin K-rich foods was affecting her medication's effectiveness. After her latest checkup, Nellie's doctor explained the potential interaction between high vitamin K intake and her blood thinner. She was advised to moderate her consumption of foods high in vitamin K and monitor her levels carefully. After adjusting her diet, Nellie was able to maintain proper blood thinning and improved overall health. For seniors on blood thinners, it's essential to limit high vitamin K foods or maintain a consistent intake to prevent fluctuations in blood clotting. This doesn't mean avoiding vitamin K entirely, as it still plays a role in bone health and cardiovascular function, but it's important to balance it properly within the context of medical treatment. The recommended daily intake of vitamin K varies, but for most seniors, moderation is key. Sources of vitamin K, such as leafy greens, e.g. kale, spinach, and broccoli, should be consumed in consistent, moderate amounts to avoid causing an imbalance in blood-thinning medications. In summary, too much vitamin K can interfere with the effectiveness of blood thinners, leading to serious risks for seniors who are already managing heart or blood conditions. While vitamin K is crucial for bone health and circulation, seniors should consult their healthcare providers before making any significant changes to their diet or supplement regimen. Next, we'll explore the first vitamin that seniors must absolutely eat to support their overall health, energy, and muscle strength. The best vitamin number 1, vitamin C, a powerful antioxidant that boosts immunity and supports muscle health. As we age, the body's ability to repair itself and fight off illness becomes less efficient. Vitamin C is one of the most important nutrients for seniors, offering numerous benefits that support immune health, muscle function, and overall vitality. This powerful antioxidant helps neutralize free radicals, protecting the body from oxidative stress and reducing inflammation, which can have a significant impact on muscle recovery, joint function, and overall well-being. Vitamin C is essential for the production of collagen, the protein that supports the structure of muscles, bones, skin, and blood vessels. As we age, collagen production naturally declines, which can contribute to muscle weakness, joint pain, and skin aging. By ensuring an adequate intake of vitamin C, seniors can help maintain muscle strength and flexibility, improve wound healing, and support skin health. Unlike some vitamins, the body cannot store vitamin C, so it needs to be replenished regularly through food or supplements. One of the best sources of vitamin C is citrus fruits, like oranges, lemons, and grapefruits. But other fruits and vegetables, such as bell peppers, kiwi, and broccoli, also provide high doses of this essential nutrient. Let's consider the experience of Eleanor Ellie Barnes, an 80-year-old retired schoolteacher from Raleigh, North Carolina. Ellie had been struggling with joint stiffness and low energy as she got older. Her doctor suggested increasing her vitamin C intake, and Ellie started incorporating more citrus fruits and leafy greens into her diet. After just a few weeks, she noticed significant improvements in her joint flexibility and a boost in her energy levels. Ellie also found that her muscle recovery after her regular walks became quicker, and her skin appeared more hydrated and youthful. Vitamin C is also crucial for the immune system, helping the body fight off infections and promote wound healing, especially important for older adults who may have weakened immune systems. It supports the body's ability to fight inflammation and reduce oxidative damage, both of which are linked to age-related diseases like arthritis, heart disease, and muscle degeneration. To incorporate more vitamin C into your diet, try adding citrus fruits to your breakfast, including oranges, grapefruit, or a glass of freshly squeezed lemon juice. Berries, kiwi, and tomatoes also pack a punch of vitamin C, making them excellent choices for snacks or added to smoothies. In summary, vitamin C is one of the best vitamins for seniors. It supports muscle health, immune function, collagen production, and overall vitality. By incorporating more vitamin C-rich foods into your meals, you can help preserve muscle strength, boost energy, and improve joint flexibility as you age. Next, we'll explore the second essential vitamin that plays a crucial role in bone health and muscle function for seniors. The best vitamin number 2, vitamin B12, a vital nutrient that supports muscle strength and energy. As we age, our bodies undergo various changes that can impact nutrient absorption, and vitamin B12 is one of the most critical nutrients that seniors need to maintain optimal health. This vitamin plays a key role in nerve function, muscle strength, and energy production, making it an essential nutrient for older adults. Vitamin B12 is involved in the production of red blood cells, which carry oxygen throughout the body. It also plays a critical role in DNA synthesis, helping the body produce new cells, including those that repair muscle tissue. For seniors, vitamin B12 helps maintain muscle mass, especially as muscle loss becomes a common issue with aging, known as sarcopenia. Deficiency in this vitamin can lead to muscle weakness, fatigue, and numbness or tingling sensations due to nerve damage. The biggest challenge with vitamin B12 in seniors is that absorption decreases with age. The stomach's ability to produce the acids necessary to break down food and release vitamin B12 declines, making it harder for seniors to get the nutrients they need from food alone. As a result, many seniors are at risk of B12 deficiency, which can lead to muscle weakness, fatigue, and cognitive decline. Let's consider the example of Mildred "Millie" Harrison, a 74-year-old retired accountant from Kansas City, Missouri. Millie had been feeling increasingly fatigued and noticed that she was struggling to complete her daily walks. Her doctor ran a blood test and found that her vitamin B12 levels were very low. Millie began taking a B12 supplement and made changes to her diet, incorporating B12-rich foods like eggs, fish, and fortified cereals. Within a few weeks, Millie experienced improved energy, stronger muscles, and less fatigue, allowing her to enjoy her morning walks again. Vitamin B12 is found in animal-based foods such as meat, poultry, fish, eggs, and dairy products. For seniors who follow a vegetarian or vegan diet, fortified cereals, nut milks, and B12 supplements are good alternatives. It's also important to note that B12 deficiency can be slow to develop, meaning symptoms may not appear until the deficiency is more severe, so seniors should have their levels checked regularly. In summary, vitamin B12 is one of the best vitamins for seniors, as it supports muscle health, energy levels, and nerve function. Seniors who are experiencing fatigue, muscle weakness, or cognitive changes should consider having their vitamin B12 levels checked, as deficiency can significantly affect overall health. Next, we'll dive into the third essential vitamin that plays a critical role in maintaining bone strength and immune function in older adults. The best vitamin number 3, vitamin K, a crucial vitamin for bone health and muscle strength in seniors. As we age, one of the most important concerns for overall health is bone strength. Vitamin K plays a vital role in maintaining strong bones and preventing fractures, which are particularly important for seniors at risk of osteoporosis and other age-related bone conditions. This essential vitamin is not only beneficial for bone health, but it also plays a critical role in muscle function, circulation, and joint health, all key components of a strong and active lifestyle for older adults. Vitamin K is a fat-soluble vitamin that exists in two main forms, K1 phylloquinone and K2 menaquinone. Vitamin K1 is primarily found in leafy green vegetables like spinach, kale, and broccoli, while K2 is found in fermented foods like natto, cheese, and egg yolks. The two forms of vitamin K work together to activate proteins that help regulate calcium in the bones and blood, promoting healthy bone mineralization and preventing calcium from being deposited in soft tissues, which could lead to arterial stiffness or even heart disease. For seniors, vitamin K deficiency can lead to weakened bones, joint pain, and increased fracture risk, especially for those who already suffer from osteoporosis. Low levels of vitamin K have also been linked to muscle weakness, as the vitamin helps maintain muscle strength by supporting the activation of calcium in muscle cells. Without enough vitamin K, muscles may be more prone to cramping, fatigue, and slow recovery from physical exertion. Let's look at the case of Franklin "Frank" Doyle, a 78-year-old retired postal worker from Phoenix, Arizona. Frank had been struggling with joint pain and difficulty getting up from chairs after long periods of sitting. He also noticed that he had been feeling more stiff after his morning walks. After a visit to his doctor, Frank was told that he was vitamin K deficient, which could be contributing to his bone and joint problems. After incorporating more vitamin K-rich foods like kale and broccoli into his diet, along with a K2 supplement, Frank noticed a significant improvement in his joint mobility and muscle strength. He felt less stiff, his muscle recovery improved, and he was able to move with more ease. The best sources of vitamin K include leafy greens like kale, spinach, and collard greens, as well as fermented foods like miso and natto. If you are concerned about your intake of vitamin K or are taking blood thinners, it's important to consult your healthcare provider before significantly changing your diet, as vitamin K can interact with blood-thinning medications. In summary, vitamin K is an essential nutrient for bone health, muscle strength, and joint flexibility, all crucial aspects of healthy aging. Seniors who want to protect their bones from osteoporosis and enhance muscle function should include vitamin K-rich foods in their diet to ensure they're getting the necessary nutrients for optimal mobility and overall health. Next, we'll explore the fourth essential vitamin that helps support immune function, energy, and cognitive health in seniors. The best vitamin number 4, vitamin B6. A vital vitamin for cognitive health and muscle strength in seniors. As we age, brain health and muscle strength are two of the most important factors in maintaining independence and quality of life. Vitamin B6, also known as pyridoxine, plays a crucial role in supporting both cognitive function and muscle health. This water-soluble vitamin is involved in the production of neurotransmitters, such as serotonin and dopamine, which are essential for mood regulation, memory, and nerve function. It also helps with protein metabolism and muscle function, making it a key player in maintaining muscle mass and preventing muscle cramps and weakness. Vitamin B6 is unique because it supports both brain function and muscle recovery, making it an essential nutrient for seniors who want to stay mentally sharp and physically strong as they age. B6 deficiency is common among older adults and can lead to memory loss, depression, and muscle weakness. It can also interfere with nerve function, leading to tingling, numbness, and painful nerve conditions. Let's consider the story of William Bill Martinez, a 73-year-old retired firefighter from Salt Lake City, Utah. Bill had started noticing difficulty concentrating and frequent muscle cramps after his daily walks. His doctor ran some tests and found that his vitamin B6 levels were low. Bill began taking a vitamin B6 supplement and also added more B6-rich foods to his diet, such as chickpeas, potatoes, and bananas. Within a few weeks, Bill felt mentally sharper, his muscle cramps decreased, and his mood improved. "I feel like I'm back to my old self again," he says. "I have more energy and my brain seems clearer." Vitamin B6 is found in a variety of foods, including chickpeas, potatoes, turkey, tuna, and bananas. The recommended daily intake of vitamin B6 for seniors is about 1.5 to 2.0 milligrams per day, and it's essential to ensure you're getting this nutrient from your diet or supplements, especially as we age and our bodies absorb nutrients less efficiently. One of the major benefits of vitamin B6 is its ability to support protein metabolism. This means that it helps break down the proteins from the foods we eat into usable amino acids, which are essential for muscle repair and growth. For seniors looking to maintain or increase muscle mass, getting enough vitamin B6 can make a significant difference. In summary, vitamin B6 is a crucial vitamin for seniors, as it supports brain function, muscle strength, and nerve health. Seniors who experience memory issues, muscle cramps, or fatigue should consider increasing their intake of vitamin B6 through food sources or supplements. This vitamin can help you stay mentally sharp, energetic, and strong as you age, making it an essential part of a healthy diet. Now that we've covered the 4 essential vitamins that seniors should focus on, remember that balanced nutrition is key to aging gracefully. Incorporating the right vitamins into your diet will not only improve your muscle health and cognitive function, but also help you maintain a strong, active lifestyle. As we age, the importance of nutrition becomes even more critical. The right vitamins can significantly influence our bone health, muscle strength, energy levels, and overall well-being, while excessive intake of certain vitamins can have harmful effects, especially if taken without proper guidance. In today's video, we've explored both the vitamins seniors should avoid and the essential vitamins that help promote healthy aging. We started by highlighting the 4 vitamins to avoid, vitamin A, vitamin E, vitamin D, and vitamin K. While each of these vitamins plays an important role in maintaining overall health, too much of them, especially from supplements, can lead to serious issues such as bone fragility, blood clotting risks, toxicity, and interference with medications. Understanding the right balance of these nutrients is key to avoiding their potentially harmful effects. On the flip side, we also focused on the 4 essential vitamins that seniors should actively incorporate into their diets: vitamin C, vitamin B12, vitamin K, and vitamin B6. These vitamins are not only essential for muscle health, immune function, and bone strength, but they also enhance cognitive function and improve overall vitality. By ensuring adequate intake of these vital nutrients, seniors can boost energy, reduce inflammation, and maintain a higher quality of life as they age. At NUTRIHUBBLISS, we understand how important it is to make informed decisions about nutrient intake, particularly as we grow older. By choosing the right vitamins and avoiding excess, seniors can nourish their bodies, prevent deficiencies, and enjoy a strong, healthy life for years to come. We hope today's video has given you the insight to make smarter decisions about the vitamins you consume, ensuring you get the right balance to stay healthy and active. If you found this video helpful, let us know in the comments. What changes are you making to your vitamin intake? And don't forget to like, share, and subscribe to NUTRIHUBBLISS for more expert advice on healthy aging and optimal nutrition. Here's to aging well, one healthy choice at a time.